You're watching a special edition of Medical News Network, your trusted source for the latest information in medical and dental procedures. I'm Mike Wiggenstein, and thanks for joining us. We brought our cameras here today to the offices of Thomas Gonzales, a recognized leader in reconstructive and sleep or IV sedation dentistry, to find out just what this can do for people. So if you have bad teeth, you're afraid of the dentist, or you just need help and don't know who to turn to, my recommendation is sit back and get comfortable, and I'll see you inside.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Hi, is Dr. Gonzales in? It's Mike with Medical News Network.
Certainly, he's been expecting you. Go right in.
Thank you. Dr. Gonzales.
Welcome, Mike.
Thank you very much. First of all, I want to really thank you for actually welcoming me or inviting me to come out today. A lot of people get really nervous when they hear I'm coming to poke around and prod around in their business. I wanted to talk to you mainly because, you know, I do business a lot here in Vegas. I have my shows there. But over the last 6 months to a year, I've received a lot of information about you in particular, from people who were extremely afraid of the dentist, people that hadn't been to the dentist in 20 years, and a lot from people that had their whole mouth rebuilt, according to them, in one visit.
Right.
Can you really do that?
Yes.
Is that something that happens here every day?
Yes, it does.
Is that the focus of your practice? Is pain or the lack thereof and full mouth reconstruction, is that what you focus on?
We focus primarily on sedation dentistry, implants, and cosmetics, yes.
And the second I ask is your building is absolutely gorgeous.
Well, thank you, Mike.
I mean, it's mostly when you go to a dentist office, I deal with a lot of dentists all across the country. They're usually in a little corner somewhere, third floor, second door on the right. This is a standalone facility, obviously right next door to the hospitals. But this building is beautiful. Did you design this? Tell me about how this building came about.
Well, my wife and I, we did design it. We sat down with an architect. We told her what we wanted, what colors, everything. We all put it together, yes.
It's incredibly beautiful.
Thank you.
So before I get to talk to the patients, take a few moments and show me around.
Let's go see the office, Mike.
All right.
Several years prior to meeting Dr. Gonzales, I had some dental work done, primarily veneers. And the work was pretty good. I had noticed that over the years that the work had deteriorated, the discoloring had come back, and I realized that maybe I hadn't chosen the right quality. There is a big quality difference. I believe that when I smile, you cannot tell that I have had work done. When I smiled before, I think you could tell that I had had work done. There is an association of the quality of person that you are, the type of person you are, the level of person you are, based on your smile. I'm not saying that's fair or that's right. You have to feel comfortable with the doctor. I think that's more important than a lot of other parts of the procedures, is do you feel comfortable, because that's what takes away the anxiety. The second part is the quality of the work, and I'm lucky, Dr. Gonzales hit it out of the park with me. I mean, I got a high quality doctor, and I've got an incredible smile. I feel like part of the family here. She mentioned about technology, lasers. How important is technology and equipment in what you do?
Well, let me give you an example of that, Mike. This is called an iCat, and this is an X-ray machine that gives us 3D imaging. And what this does is...
Three-dimensional, so you can see the bone as a bone versus
Yes.
a typical X-ray where it's just one dimension.
Right, we can see inside the bone, actually. So what we can do is we're looking at the bone as if we went in and peeled the tissue back and taken a look at the bone. Because that's how...
It's my understanding that most dentists lay your gums open and peel them back to look. And then
if they want to find out, yes, you have to do. But what we can do with this is we can look inside, and we don't have to do it with even picking up a scalpel or anything. We can just turn it around, we can look, take slices, we can see the thickness of the bone, the density of the bone, the quality of the bone, even the length of the bone. We can do all this planning just with this X-ray.
Plus then you have it for down the road planning too. You don't have to reopen that gum up or look at anything. With the type of patients you do, and obviously you do a lot of patients that are high fear or high anxiety patients, are you able to give them comfort in the fact that you don't have to even open their mouth to see what's going on?
Oh, definitely. This does so much more that...
Now, do all dentists have one of these?
Not too many dentists have them. I'd say less than 0.5% of the dentists in the country have one of these machines.
So if somebody wants this kind of technology, do they normally send them to the hospital for an X-ray? Do they make them drive somewhere else?
That's exactly what they have to do. They have to send them to a hospital to have one of these taken, or to a diagnostic center where they do have them.
Okay, and this machine, they come, they sit down once, and again, it just circles their head one time.
That's right.
And
It's
then
a
you have all the
20-second scan, and we get all that information.
And there's no pain for them?
Not at all.
No pain, no worry.
No, not at all. When Gail first came in, I saw a lady that was terrified. I mean, I knew I couldn't really touch her the first visit. You know, I was just going to talk to her, find out what she needed, and take a look in her mouth, possibly, and that was about all I was going to get done. So we took a look, and we saw that she needed a lot of attention. We said, we can fix her. But she told me, not while I'm awake, and I said, that's no problem. I said, we can do that also. So we got her back, and we sedated her, and we put in some implants, took some teeth out, did some root canals, did some fixed bridges. We aligned her jaw. We found out where her bite should be, and we did some perio surgery. So she walked out of here with teeth all over her.
On my first visit, when I came here, I was terrified to come. It wouldn't have mattered where I was going for a dentist, I would have been terrified. And I was afraid of what they were going to tell me. I thought they were going to tell me that I had cancer in my mouth or who knows what. My mind was going. It was working overtime. So that got me in a state, and by the time I was here, I was a mess. And then I believe I had nitrous oxide, did I?
Yes.
Yeah. And the IV. I had the full boat. I went the full plan. I remember them putting in the IV, not feeling it, thinking, wow, that's nice, because normally that's kind of a scary time. And that's it. I woke up, and it was over. Don't remember leaving. Went home, slept. You called me.
Mm-hmm.
That's all I remember. That's it.
When she first walked in, she was totally terrified. But then once she was sedated, it's just like the most perfect patient, because she's an easy sedate. So it's so easy to work on.
I'm great knocked out.
Yeah. If you tried to work on her otherwise, there's no way you could ever accomplish anything.
No.
No. And then under sedation, we were able to do implants, extractions, root canals, perio surgery, and not to mention putting crowns on all the remaining teeth. We did all this in basically one appointment.
One appointment.
Yes.
When I came in, I knew I was going to have a lot of work, but I didn't know I was going to end up with this great amount. You know what I'm saying? I didn't know it was going to be this good. Yeah.
Good.
He's great. He's the best.
You know, everybody we talked to today has talked about getting things done in one visit. How do you do that?
Mike, let me show you my lab.
Okay. So you build the teeth right here?
We build them right here, yeah.
On site?
On site.
You don't send them out?
Nothing gets sent out.
Normally, teeth are sent out.
In most dental offices, everything gets sent out, right.
So you're able to actually, while the patient's out, if they're under sedation or while they're you're able to actually build their teeth?
Right. We can.
While they're here?
Right.
Now, does the lab man, do you think that gives you, do you think it gives you an unfair advantage over most people?
I think it definitely gives us an advantage. I don't know if it's unfair, because they have the opportunity to do the same thing.
Why do you think they don't? I mean, obviously, and in talking as a patient, you know, I have an implant, and the restorative was done, and when I opened my mouth up, the tooth was a little bit different color than all the rest.
Right.
And so I went back to the dentist, and I says, and he took it out, and it was about 2 weeks later, the tooth came back.
Right.
Are you saying that that's something you would do while they were here?
We would do it right then and there. While the patient is still in the chair, we'd take it out, we'd stain it, give it back to the lab man. He'd walk in here, and he would give it right back to us. As a matter of fact, the patient would come in here and watch, too.
All right, well, now, I will tell you, and I'm not tooting your horn or whatever, but I spend my life inside dental offices, and I look at people's smiles. So far, everybody that I've talked to today, their smile has been very natural. It doesn't look like it's a veneer. Do you think that the lab tech, I mean, do you let him actually go out and sit down with people and get to know them?
Every patient, before we start, they meet the lab technician. He comes into the room. They will explain to him what they want to look like. If there's any changes they want to make, or if they have a picture of somebody else who's smiling.
Well, somebody said that you had the person actually bring a picture in of every year of her life so that you could give her a smile that was progressive with who she was. And do you think that skin color, Do you think that tones of teeth, I mean, a person's skin color, face shape changes how their teeth should look?
Sure, it does. But everybody's different, too, on their perception of what they want. You know, what I give you may be different from what I give somebody else. And that's what they will communicate with us.